1 in 4 children suffer from a visual impairment. In almost all cases, these impairments can be treated. But first, you need to know that you're not seeing clearly.
Well, we know that learning in the classroom, 80% of it is related to vision. So, vision is really important when it comes to a child's learning potential. But not only do we want the child to be able to see well, so seeing 20/20, we want the child to have overall a great visual system. So, that includes how the eyes work together. So, the eye teaming or the eye coordination. Also, eye tracking. So, are they able to track their eyes well while they're reading? Also, eye focusing. So can they change their focus from reading something up close to then looking into the distance to copy something off of the board and go back to their work up close?
October is Children's Vision Month, which is meant to serve as a reminder for parents and their kids to have their eyes checked.
Visually, they may be seeing well, but like we talked about, some of these symptoms don't seem to be visually related, but actually can be a sign of a vision problem. So if your child is having any difficulties with attention at school, the fidgeting in the chair, maybe a possible head turn or an eye turn, other things we're looking for are difficulties with balance. The balance and the visual system are very closely integrated. So problems in vision may affect the balance and how the child is walking. Are they bumping into things? Those are all things that are really important. So just bringing your child in for a full comprehensive eye exam. They're covered under OHIP in Ontario for a full eye exam once every year. So there's no cost to the parents, and it's just a really good idea so that we can make sure the vision is developing as it should be and that the child's reaching their full learning potential.
There's a variety of ways that you can be treated for a visual impairment, depending on your circumstances, and that's determined by a thorough examination.
The first part is actually just identifying that, which is sometimes difficult because we often don't think that the symptoms that kids are having are actually visually related. So some of the things that I'm looking for, listen for in an eye exam is the child having difficulties with attention at school? Do they fidget a lot? Are they even engaged in reading? A lot of children who have a hard time using their eyes together will not even be interested in reading because it's so difficult for them. Do they start to close one eye when they're reading or turn their head? Any of those signs are actually sort of signs to me that something's going on with the visual system. So when I have a child with concerns like that, we want to make sure we're doing a full assessment. So we look at the eye tracking, the eye teaming, I look at depth perception, but oftentimes, if the child is having some problems, we may need to probe a little bit further with some visual perceptual testing. So we look at how the brain is actually processing that the visual information as it's coming into the brain. How is it being processed? So at our office here, we actually do some visual perceptual testing. And if we identify a child who does have some learning-related vision problems, they may need glasses, but that's often not the only thing that we need to do with them. So we often enroll them in a vision therapy program where we're actually working on all those visual skills. So getting the eye tracking where we expect it to be. Can the child track and move their eyes without moving their head? And we work on eye teaming, so coordinating the two eyes together so that it becomes a lot easier for them.
It's important to note that the vision therapy program isn't just for kids. You can find out more information about their program at tracybrody.ca. And if you'd like to know more about Children's Vision Month, visit opto.ca. Reporting for Halton Insider, I'm Shane Lansing.